Hi, Mr. Peters, Dr. Rubin. Today we're going to be doing your lumbar facet injections. Okay, and this is part of a three-step process. The first 2 times, the lumbar facet injections. The next time will be a medial branch block. The idea behind these injections and the facet injections is that we actually put medication, a little bit of steroid and some numbing medication in the joints on one side of your lower back. And the idea is to see if you get really good temporary relief. There is some steroid in here, so sometimes patients do feel good for a long time, but even if you get a few days of really good relief of your back pain, that's the information we're looking for. Now, if the facet injections work, the second step will be a medial branch block. The difference between the medial branch block and the facet injections, there's a lot of overlap actually. The facet injections, we try to get medication right into the joint and around the nerve that goes to the joint. The medial branch blocks, we're just trying to get medication and numbing medication on the nerves that innervate that joint. Again, the idea behind this is there's a lot of structures in your lower back that can cause pain. The joints are a common source of pain, especially chronic low back pain. So we're trying to pinpoint the source of your pain by doing these diagnostic injections. Of course, if your pain's not coming from here, you won't get any relief, and that's important information for us to know. Does that make sense to you?
Yes.
There are some medications that you will have to be off of for 7 days prior to your injection. Some of these medications do require us to get medical clearance from your physician that placed you on this medication. Some of these medications do require lab work prior to your procedure. If this is the case, then we will alert you prior to your procedure. Make sure that you do not eat or drink anything 4 hours prior to your procedure. You can take your blood pressure medication prior to the procedure with a small sip of water. After the procedure, if you do develop a headache, please notify our office as soon as possible.
For the lumbar facet injections, we're going to have you laying on your stomach. We're going to have your head in a headrest, and if you're going to use the nitrous will come through that headrest. The first thing we're going to do is clean your back. After the area on your back where we're going to perform this procedure is cleaned and prepped, we're going to use our x-rays to localize our injection site. The facet or joint in the lumbar spine, or cervical spine if we're doing a cervical facet injection. The next step is to put some lidocaine, which is some numbing medication. It does sting for just a second, and then it will numb the skin where we're going to do our injection. A little poke here. You doing okay, Mr. Peters? And now we will use x-ray to place our needle into the first joint to do our first injection. Once the needle is placed in the facet or joint that we're approaching, medication will then be injected. This will be steroid and some numbing medication. Okay, I'm going to place some of this medication into that joint. You may feel some pressure or discomfort while the medication goes in. Now, during your injection, we'll be doing 3 different joints in either your lower back or cervical spine during this treatment. All right, a little poke and a sting, some more lidocaine. The facet you can think of as another name for the joint, either in the lumbar, thoracic, or cervical spine. More than one injection is done during these procedures because you have multiple joints in your lumbar spine. They're on each side. We'll do one side at a time, and to get each joint, there'll be multiple injections so that we can cover the joints that we think are under stress or the ones that are most likely to be causing your pain. So what we do is place a needle inside those joints. We inject some steroid medication and numbing medication, and we also put some steroid and numbing medication on those nerves that innervate that joint. And we're now going to inject the third joint in your lumbar spine that we're treating today. And there's a little bit more lidocaine. 1, 2, 3. With that steroid, some people get good relief with just that, but really we're looking to see if a patient gets good temporary relief from their symptoms by injecting the joint and that nerve that innervates that joint. This gives us a good idea of whether or not those joints are the pain stimulus that the patient's feeling. And now we're doing the final injection into the joint for this facet joint injection. You're all done, Mr. Peters, good job. If you do get good relief from these facet injections, we'll be doing medial branch blocks as the next step. And that procedure is very similar to this procedure, except we'll be targeting just the nerves that innervate the joint. The medial branch block is actually blocking the nerves that go to that joint. With the facet injections, we do a little bit of both. With the medial branch blocks, we're just numbing up that nerve that goes to the joint. Both of them are an attempt to see if you get good, at least temporary relief of your pain, trying to pinpoint that it is the joint that is causing your pain. In your treatment of facet disease, rhizotomy is the last step. If you did get very good temporary relief from both the two diagnostic injections that we did, that gives us a high suspicion that your chronic low back pain or low back pain you're having is coming from the joints in the area that we treated. To try to give you longer term relief, we then do a rhizotomy. The rhizotomy, we use needles very similar to the needles you had in the other injections, but these needles heat up on the end. And what we do is place them anatomically where the nerves that innervate the joints are located. We then burn those nerves and get rid of them so you no longer feel that painful joint. These are very small nerves, and of course they can grow back over time. Often this takes a year or 2 years, and this procedure can be done again. We don't jump straight to a rhizotomy because, as mentioned earlier, there's many different sources of back pain. And again, the joints are just one possible source. The first steps prior to a rhizotomy are trying to localize your source of back pain. So when we put numbing medication and/or steroid in and around that joint, if you get good temporary relief on 2 separate occasions, that helps pinpoint that it's likely that at least some of your pain is coming from those joints. We can then move on to the rhizotomy and try to give you longer lasting relief. This procedure can be done again if you get very good relief for 9 months, a year, or 2 years. Those nerves may grow back and we could do the same procedure again and hopefully give you long-term relief. Well, the facet injections are different from epidural steroid injections in the placement of the needle and what we're injecting. So an epidural steroid injection, as you can see in our other videos, we'll be putting steroid medication underneath the lamina in the lumbar spine, and that medication will then get onto and around all the nerves in the lumbar spine. That's often very good for patients with back pain and leg pain. And the goal of epidural steroid injections and facet injections are different. There's many sources of back pain. With the facet injections, we're going after the joints in the lower back or in the cervical spine. The joints can be a common source of chronic pain. And so what we do, again, we put in numbing medication and some steroid into that joint. The numbing medication does not last very long. It can be anywhere from 3 to 12 hours. And we're looking to see if you get very good relief when that numbing medication is active. There's also a little bit of steroid, and sometimes that will provide a little longer relief. But it's very common for patients that do have facet pain with these first 2 injections to just get temporary relief. That is expected. Of course, not everybody's pain is coming from the facet joints in the back or neck, and you may not get any relief from these diagnostic procedures, but that's important information as well. If you're having back pain on both sides, generally we treat the side that hurts the most first. There's a lot of joints in the lumbar spine and we can't address them all at the same time. So we usually start on the side that hurts the patient most, or if it's just unilateral pain, we'll just do that side. We usually go through the process on one side, and if you have residual pain on the other side, we can then perform the rhizotomy on that opposite side.